CataractCoach.com. The advantages of Zepto capsulotomy, an automated way of making an anterior capsular opening for a wide variety of cases. I am a paid consultant to Centricity Vision, the makers of this device. This video, however, is not me operating. It's Dr. Paraj Majmudar, a good friend of mine from Chicago, and he's just going to do a routine cataract case here. We're going to show you the case at 2 times normal speed so you can see the whole video in an efficient manner. So a pretty routine case, good draping, nice paracentesis, filling the eye with a dispersive viscoelastic, and here comes the main incision. So making that main incision here, and then the Zepto device is what's next. In the Zepto device, you're going to use this to create the anterior capsular opening. And so this device has a nitinol ring that's collapsed initially, and you can see there it goes through your small incision, as small as 2.2, and you place that inside the eye, and then you can open and expand the ring. There it is, about a 5 millimeter capsular opening comes up. There it is, expanded to round, and you center it up wherever you want. Apply a little suction, and then in a fraction of a second, a short pulse of energy will create an instantaneous capsular opening that's perfectly round, and it's centered where you want it. Now, the nice thing here is you can center it wherever you wish. It's always going to be consistent. You know it's fantastic for a case of an intumescent white cataract, but it's also very good for a routine case. So you can see you get that rhexis that's centered up on the visual axis. Look at the Purkinje images, and you can see where the rhexis is, or the capsulotomy, and it's beautifully centered. And so at this point, now you can do your hydrodissection and do your case and basically normally, proceed normally. Now, you can also use this in a smaller pupil case. Let's say you had a case where the dilation was only 4 millimeters. Well, you can still put this device under the iris and put it right on the anterior lens capsule and still create your 5 millimeter capsulorhexis, even in a case where the pupil is 3 or 4 millimeters. So that's a big advantage of, let's say, a femtosecond laser, because femtosecond laser requires that dilation in order to pass the laser light energy through the tissue. And if it doesn't dilate, you can't do it. So in this case, you can place this in the eye, even with a small pupil. And you can see here, Dr. Majmudar is going to break up that nucleus, a little bit of a groove made initially, and now just kind of a chop technique to break it up into smaller pieces and remove it from the eye. Now, another advantage here compared to femtosecond lasers, the femtosecond laser is far more expensive. Many times more expensive. You look at a femtosecond laser, you're looking at hundreds of thousands of dollars, even $500,000. And this device is a small fraction of that. And the per case use fee is also much less than using a femtosecond laser. So if you have a case where you have a challenge like an intumescent white cataract, or even a routine case like this that's going to get a premium presbyopic EDOF IOL, you may want to ensure that great rhexis or that great capsulotomy centration, and you can do that by using this device. So again, I like to show you just various options, things you can use. Here you can see the nucleus is nicely removed. Now just kind of cleaning up the cortex, and the rest of the case will proceed normally. You know, my advice to you, especially if you're a young surgeon, is learn to use all the tools in the toolbox, and always want to add more and more tools to your repertoire. You want more options, not less options for your patients. You can ultimately choose then. You say, you know what, for this patient, I think the best option is going to be this device or this tool or this technique or this IOL. But number one, be loyal to your patients first, and number 2, to yourself second. And so try out all the devices from all the companies, even the competitors. And again, you never know which tool you'll need in which situation. You can imagine a case that's with an intumescent white cataract that we talked about, but what about loose zonular support? There are cases where you'll struggle to make the rhexis because when you get in there, the capsular tissue is so loose. Well, here's a way of making your capsulotomy instantly without any issue. You don't need that counter traction. You don't worry that the capsular bag is wrinkling, etc. Now, interestingly here, there's a little bit of subincisional cortex. I like this technique of first get the lens in the eye. You can use that to help loosen up that subincisional cortex and then remove the subincisional cortex. So a very nice technique there. And now as you see, as the lens opens up, you know that lens has a 6 millimeter optic. And then you can see that the capsulotomy is a very precise 5 millimeters. And I anticipate that centricity vision is going to come out with options to make the rhexis different sizes as well. Now, with the capsular bag being opened up with viscoelastic and the posterior capsule held away with the optic, now that subincisional cortex was very easy to remove. Here's going behind the IOL to remove the viscoelastic, and this looks like a very clean case. And now that lens can be centered up, and we can seal up the incisions. You can tell, looks like that's an extended depth of focus lens. Looks like to be an Alcon Vivity lens. And you can see that central focusing element. And those Purkinje images are beautifully centered as well. And then just sealing up the incision here and calling this a day. So nice case. I encourage you to try all these new techniques, including the Zepto device. Thank you for watching.